Melbourne is on edge this morning, waiting to see if this COVID cluster that originated at an airport quarantine hotel spreads into the community beyond workers and their household contacts. Adding to the concern, an alert that's gone out for a cafe at the airport during a period where flights took off for destinations around the nation. Reporter Steffi Ferrier joins us now from Melbourne. Steph, g'day. So those daily numbers are just through in the last 20 minutes or so for this morning. Do they add to what was already known from last night or not?
It doesn't appear as if they do add to the numbers that we knew, but we are seeking clarification from the Department of Health at the moment because there are 5 cases that have been listed as locally acquired cases. Now, we knew yesterday that we had 2 household contacts, the spouses of 2 of those workers. We knew about that just early yesterday afternoon, and then a press conference with Jerome Weimar around 4 o'clock said that there was also an assistant manager at the hotel. And then it continued to evolve. Around 11 o'clock last night, we also heard about a following 2 household contacts of previously reported cases. So that brought that cluster for the Holiday Inn up to 13. Now, in terms of this 5 new numbers, what's thrown us a little bit is a subsequent tweet from the Victorian Government's Department of Health saying that one of these cases was formally reported after midnight but has been included in yesterday's numbers. So we are pretty sure that the 5 still relates to the 5 we already knew about. It's just this one case that was formally reported after midnight but was included in yesterday's numbers as public health actions began yesterday, including the case interviews. So we don't know whether or not that's one of those 2 cases that we heard about around 11 o'clock with a tweet saying that there were those 2 household contacts. It's important to note that all of these cases are connected to the Holiday Inn cluster, and that at this stage we still don't have any community transmission. So that is at least some sort of reassurance to people here in Victoria.
Yeah, and I guess
now, I was going to actually say, just in terms of that, obviously, whilst it is some reassurance, they are still working very hard with all of the close contacts as well. And we also need to find out whether or not, these people were actually isolated and at what stage they were isolated, because we do have this double ring or this secondary contact ring to protect from any clusters sort of further developing into the community. And Jerome Weimar actually did talk about this and say that in Melbourne's football colloquialisms, we are still just at the first quarter or the opening quarter of this Holiday Inn cluster, and there's still a lot more work to be done.
Still at an early stage of this Holiday Inn outbreak. We're still trying to get a sense of how far transmission has already occurred, and we need to ensure that we keep running faster than the virus to ensure we run it to ground.
And so, Steph, there's speculation about what the government might announce this morning. Have we got a time on that media conference yet, or any indication on what's going to be said?
Yes, we're still waiting for that time, and we are very eagerly awaiting that time because the government spokeswoman I've been speaking to has issued a response to questions about exactly what's going on. There was a front page article in one newspaper talking about the potential for a snap lockdown. Now, she has said that briefings and meetings are happening this morning. As soon as we have the full picture, we will provide an update. Now, I do understand from a government source that the government will put up Premier Daniel Andrews at some stage this morning, so late this morning potentially if these meetings are going on, that they are at least feeling a little bit better about the fact that they haven't seen any community transmissions as yet. However, they do say that all options are being discussed and considered. So that is the very last thing that potentially Victorians want to hear after enduring months of lockdown. But the question is whether or not a snap lockdown might be a short, sharp hit to stop any of this virus spreading in the community.
And while we're saying there hasn't been any community transmission, there has been transmission from workers to their household contacts. So it has gone beyond the Holiday Inn hotel.
Yeah, so it has, but they were also isolated. Now, we have also got a little bit of a concern in terms of a new exposure site, and we don't know yet. We have requested information from the Department of Health as to who or which person this exposure site relates to, but this is a big concern because it's at Brunetti's Cafe, which is in Terminal 4 of the Melbourne Airport. That's the Jetstar terminal. Now, the health authorities are saying that anybody who visited that cafe between 4:45am and 1:15pm on Tuesday must immediately get tested and isolate for 14 days. So that is considered as a Tier 1 exposure site. And at this stage, we do know from Jetstar, they have told us that there were about 14 return legs within that relevant period, so some 27 or 28 flights that did go in and also depart from Melbourne Airport Terminal 4 at that time. So we do know that if they are requested, or it's their protocol that if they're asked for all those passenger manifests, then they of course will hand them over very promptly. And we don't know yet whether or not the Department of Health has requested those passenger manifests. It is of course a little bit of a concern because we don't know whether or not anybody grabbed a coffee or sat in the cafe before boarding a flight and then went interstate. Now, we still don't know how many passenger numbers that relates to, and we have also been told and confirmed by Melbourne Airport that that cafe has been subjected to a deep clean overnight, and so that is now all clear for operation and there has been no impacts on the operations there. But obviously this is a very fast moving and evolving situation, and we will be very keenly awaiting word from the Premier today.
And Steph, you were our key reporter during the outbreaks in Melbourne through last year. It's a strange feeling, isn't it, to be back at this point now at the start of the, hopefully this is not going to develop into anything significant beyond what we've seen, but there's this kind of trepidation, isn't there?
I think it's fair to say, Joe, that many Melburnians and Victorians are very triggered still, and they still hold very, very clear memories of what that lockdown period was like. We certainly don't want to see ourselves in that sort of situation again. However, what we also would not want to see is any virus spreading throughout our community either. So, and potentially seeing a much longer and very slow and painful response as well with all the deaths that we saw. So there are big questions that the government is obviously having to ponder right now.
Yeah, okay, Steph Ferry reporting there from Melbourne. And so we have not got a time for that media conference in Victoria just yet, but we'll bring that to you live here on the ABC News channel, and we'll let you know as soon as we've got a time for that. The Prime Minister has urged Victoria to take a proportionate response to the latest cluster of COVID-19 cases. Scott Morrison is in Melbourne today and says members of his government are working with their Victorian counterparts. Political reporter Jade McMillan joins us now from Parliament House in Canberra. Jade, g'day. So what's the Prime Minister had to say?
Well, Scott Morrison says that as far as he's aware, the Victorian government is still working out exactly how to respond to these latest cases. But he says that the Federal Health Minister, Greg Hunt, has been in touch with the Victorian Health Minister overnight. He says that the National Chief Medical Officer is also keeping across the situation. Mr Morrison says he understands why people in Victoria would be feeling nervous about what is happening. He says that the lockdowns last year had a traumatising effect, but he also says that outbreaks in other capital cities more recently have shown that authorities can get on top of these types of cases quickly. He says that Australia as a whole is in a much better position than it was during the earlier stages of the pandemic when it comes to responding to outbreaks, and he's called for a proportionate response.
They need to get on top of this quickly, and I believe they will, just as other states have, and that it should be proportionate. And Victorians have showed enormous tenacity and patience. I mean, there's no other option. And I would think that they should be able to get on top of this as other states have, and that would avoid anything like you saw last year. But I do understand absolutely the sensitivity to the prospect of that in Melbourne. That is true there more than any other part of the country. Okay. But, look at Perth, look at Brisbane, look at Sydney, proportionate, short-term responses, and they're back on deck.
And Jade, what about the issue of hotel quarantine? Has there been any change in the government's view on that in the wake of this outbreak in Melbourne originating from a quarantine hotel at the airport?
No, this latest cluster is likely to raise questions again about how the hotel quarantine system is working in Australia. Some argue that these facilities shouldn't be located in capital cities, that we should be looking at regional facilities instead. But the Prime Minister says it's not as simple as that if you moved quarantine out into regional areas, then that creates problems such as transport. He also argues that it's better to have quarantine systems closer to major hospitals. The Home Affairs Minister, Peter Dutton, has also defended the existing system this morning.
Wherever you've got human beings involved in the process, whether that's in hotel quarantine, whether it's in a regional quarantine arrangement, as Richard's pointing out, you are going to have mistakes. But as Jane Holton rightly points out, there are over 200,000 Australians who have gone through quarantine, and we're talking about a handful of cases where people have made mistakes, it seems, and the nebuliser issue is something that's regrettable, but it's happened and it's to be dealt with now.
Joe, as you mentioned earlier, the Prime Minister is in Melbourne today. We're expecting him to visit the CSL manufacturing facility where the AstraZeneca vaccine will be produced. We haven't had word from the Therapeutic Goods Administration yet that vaccine has been approved for use in Australia, but we are expecting a decision soon.
Okay, Jade McMillan there in Canberra. In New South Wales, people are no longer required to wear face masks in beauty salons, churches or gaming rooms as coronavirus restrictions ease. As of today, face masks remain compulsory only on public transport, including in taxis and ride-sharing services across Greater Sydney, the Blue Mountains, the Central Coast and Wollongong.